So thanks very much, organisers. I'm looking forward to my bottle of wine after this. To be honest, I could do with a glass now. I'm a bit nervous. So today, much like John, I'm going to be talking about my HVN contestable project. Ours is industry-led, so there's a high relevance to our industry stakeholders in this proposal, in this research project. And I work at AgResearch down in Palmerston North. So I was going to ask you to show a raise of hands who actually eats meat in this room, but when I looked at the lunch table outside, I saw a very small vegetarian section and quite a big meat section. So I'm assuming most of us do eat meat, apart from the couple of people that told me they choose the vegetarian option because it comes out first on an airplane and it's often better quality. Obviously not the case today. So we all eat meat, great. Sorry, to those that don't. This morning, a couple of our presenters, David and David talked about the future of New Zealand food exports. So we all know we need to step away from our reliance on commodity products, and I guess the massive crash in the dairy prices have really shown that New Zealand needs to step up into the added value versus commodity food area or export value. And my presentation is about meat, so I'm going to talk about the meat industry. So in 2011, the meat industry released a report, the Meat Industry Sector Strategy Report, and basically they have an aspiration to grow the New Zealand red meat sector to $14 billion worth of exports by 2025. So this is 9 years away. If we look at the current exports, we're at 6 billion. So we need to almost double our exports from meat in 9 years. And this is on top of a decreasing population of sheep and beef farmers. So basically we've got less meat animals being grown, and we're needing to increase the value of our exports from the meat industry. These might change around a wee bit with the dairy prices perhaps resulting in a shift from some of the more marginal dairy land back into sheep and beef, but it'll be interesting to see what happens. So how do we grow our exports when we've got decreasing basically animals to export, meat product to export? So we need to start thinking about who the consumers of our meat are. As alluded to again this morning, so there's been quite a good background to this already. Global populations are increasing, and New Zealand can't feed everyone. So we need to choose who will pay the top, who can and will pay money for the good quality, and what will they pay a premium for? So we know that our global markets are changing, so we're getting increasing affluent populations in places like China, and we know that these changes in affluence mean that what the consumer wants also changes, but we need to understand what they want. And there's nice stories around provenance and environmental attributes of our food that consumers are interested in, but as David alluded to this morning, they're also interested in health qualities of the food. So what will make them choose a New Zealand meat product over an Australian meat product? And it will be because ours is healthier. We hope. So we need to look at what is red meat. So we get a lot of bad press, the meat industry, and I'd just like to point out red meat is more than just a cancer scare. The way New Zealand markets its meat is mostly on wonderful female athletes, and these are amazing women. They've all been to the Olympics, and this is basically, these are the Iron Maidens, so to the international audience, these are all cyclists, and basically the premise is eat red meat, you'll get more iron and you'll have more energy. And this is basically it. But meat is more than just iron. It's a valuable source of protein, vitamin Bs, and minerals such as zinc and selenium, and also fat. So fat is almost the white elephant in the room here. Back in 1961, a doctor, I assume he was just a medical doctor, might have been a PhD as well. Anyway, he came up with this lipid hypothesis, and this is basically eating cholesterol means your cholesterol levels increase. And so the medical research grew, and basically around 1984 there was a global war, not on terrorism, but on the food we eat, in terms of don't eat eggs, don't eat bacon, they're going to give you high cholesterol. Thankfully, around 2014, people started understanding that actually replacing the fat in our food with sugar was causing other issues such as diabetes. And so in 2014, the popular media sort of conceded that perhaps we got it a bit wrong. So this is the war on fat, we say, has basically come full circle. But we still have a question around good fats and bad fats. So we have saturated versus unsaturated fats. We have omega-3s versus omega-6 fats. And so this has led on to research around grass versus grain and complex lipids, which is where I'm going to. So if we go back to the grass-fed story, so this is really New Zealand's story. Our meat is 95%, 99% probably, grass-fed. Grass-fed meat has higher levels of CLA and the precursors to CLA, and these have had proven effects on improving human health. Grass-fed meat also has higher levels of long-chain omega-3, which are also have beneficial impacts on health, and they have increased levels of stearic fatty acid, which is a cholesterol-neutral lipid. Grass-fed meat also has lower levels of the C14 and C16, which is cholesterol-elevating fatty acids. We're not sure about the impacts of grass versus grain on complex lipids. So what are complex lipids? So annoyingly to my colleagues, I will call them complex lipids, I will call them bioactive lipids, I will call them polar lipids, and then finally phospholipids. So they're all kind of the same thing in my mind anyway. There are two main groups of complex lipids. Now I've got some big words here. I can't read that. I didn't bring my glasses. The glycerophospholipids and the sphingolipids. And I've got some acronyms down there. Basically, they're a polar head with a fatty acid chain. And the polar head can change in some reason, and that makes it a glycerophospholipid, or the fatty acid can change, and that will change the class of the lipid. Anyway, these lipids are membrane bound, so basically they are found in plant and animal material. The health benefits of complex lipids are increasingly understood. One of the questions that we get asked is it the complex lipid that is proving the benefit, or the fatty acid attached to it? So the benefits of fatty acids are well known with the omega-3 story. A recent study that was published showed that when N3 fatty acids or omega-3 fatty acids were fed as phospholipids, they had a more beneficial effect than fed as fatty acids alone. Complex lipids have been shown to reduce cholesterol absorption. This is in both rodents and in humans. In the human study, there's only been 3 or 4, and at the higher levels of complex lipid supplementation, so around 3 grams a day, this is when they saw the reduction in cholesterol absorption. And we know that, and when you look at the literature, the source of complex lipids might be important in their effects. So milk versus egg. Milk tends to be showing more beneficial effects than egg in rodent models especially. But what about meat? There's only been one study that we've been able to identify that's looked at the complex lipids in meat. So this is certainly an area that is worthy of attention. So we know red meat contains lipids, complex lipids. So this is a picture of a Wagyu steak, and you can see the protein, the red bits, and you can also see quite clearly the marbling. The marbling is what provides the value to the producer. It is what consumers will pay $70, $80, $90, $100 a kilo for, and basically the fat bits are basically where we can find the complex lipids. This is a study, the heat map, shows a study that we conducted with Carl and Arvind and myself, and basically we undertook lipidomic profiling of various meat samples and looked at what classes of lipid were present and at what relative levels, so blue relatively low compared to the red. And basically what we find, the data in the box indicate the classes that are the complex lipids. So they're there, which is great. But the health impacts of these lipids from meat are or haven't been investigated. So this has led to the project that HVN has funded out of the contestable round, Complex Lipids for Enhanced Metabolic Health, and our industry partner is First Light Foods. And as I mentioned, First Light, or I might have mentioned, First Light raise Wagyu beef, and Wagyu beef has high levels of complex lipids. So the opportunity. So cardiovascular disease is a leading cause of death in both Asia and the United States. Consumers are aware of the impacts of, or the importance of diet in reducing cardiovascular disease. And cholesterol absorption is a known risk factor in getting cardiovascular disease. And we know from the literature that complex lipids from milk and egg reduce cholesterol absorption. So this has presented itself as an opportunity for red meat. And ideally, we're going to show a reduction of cholesterol absorption in consumers who eat meat-derived complex lipids. So this is the value proposition for our stakeholders. In terms of the research, so as John alluded to, contracts have been lots of fun. So the project has started officially in February, so we're a couple of months in. But we hypothesised that complex lipids extracted from grass-fed beef reduce cholesterol absorption. And we've got 4 major phases, if you like, of the research. The first one is to assess the distribution of these lipids in the carcass. So basically looking at not only high-value steak, for example, but lower-value offals and waste streams to see where these lipids are present and how we can extract them. The second is to extract the lipids out of the appropriate tissue and then design a healthy hamburger prototype that will contain the extracted lipids. Test this in a human clinical study compared to perhaps a non-healthy hamburger from McDonald's maybe, and look at blood cholesterol levels and cholesterol absorption in our consumers. And the final phase will be to draft a dossier for high-level claims. And this is basically understanding what research is required for First Light to make a general health level claim for this type of research. So our anticipated outcomes is to demonstrate health benefits of consuming food products that contain complex lipids extracted from beef, or grass-fed Wagyu, and to support First Light Foods in submitting a FSANZ claim, and contribute towards First Light's mission to be the home of the best grass-fed meat in the world. And progress to date. So as I said, we've been going for a couple of months. And we've been working with First Light Foods to understand where we can add value, so what parts of the carcass they have that are in enough volume and where the maximal gain for them will be. And we've selected some animals and tissues for analysis, and we're currently conducting those analyses. So hopefully in the next symposium we'll have some really interesting results for you. And I will leave it there with the team. So AgResearch, First Light Food and the University of Auckland are taking on the challenge of, high-value nutrition. That's the catchphrase that they made us say 1 million times. So that's it. Thank you very much.